The United Republic of Tanzania is committed in achieving Millennium Development Goals 4 and 5. The country is on track to meet the goal of achieving child mortality reduction as a result of key interventions in child health. The interventions include integrated management of childhood illnesses, which address malaria, pneumonia, diarrhea, and malnutrition in an integrated package, a high coverage of immunization, vitamin A supplementation, and use of insecticide-treated nets. The Millennium Development Goal 4 for Tanzania means a reduction from its under 5 child mortality rate of 162 per 1,000 live births in 1990 to 54 per 1,000 by 2015. That is a reduction of 2/3. The 2010 Demographic Health Survey shows that the under 5 mortality rate is 81 per 1,000 live births. This is a 45% reduction from the level of 1999. Tanzania public expenditure on health is currently at 12.1%, a gradual increase since 2008. Such increased expenditure has been strongly correlated with increased survival in children younger than 5 years, especially in rural populations. Furthermore, the implementation of the government policy on health sector reform addresses decentralization and devolution of power to the local government authorities. An improvement in the quality of service delivery and addressing social inequities has contributed to reaching the marginalized population. Block and equalization grants were introduced that gave individual districts substantial financial resources. This opened opportunities for local problem solving and allowed districts to selectively increase resources for key interventions under the Essential Health Package, which included maternal, newborn, and child health. A good example of integrated maternal, newborn, and child health services provision is seen in Mkuranga District Hospital. Set in a rural area 80 kilometers outside of Dar es Salaam, it serves a rural community population of more than 220,000, providing integrated antenatal, maternity, child, prevention of mother-to-child HIV transmission, and family planning services. Despite the impressive progress in reduction of child mortality, the reduction of maternal and newborn deaths has not been significant. The 2010 Demographic Health Survey shows that the maternal mortality ratio is 454 per 100,000 live births. This is far from achieving the MDG-5 target of 193 per 100,000 live births in 2015. There is a lot of effort to attract women to deliver in health facilities. However, in many facilities, there is still limited space and lack of personnel, as is the case in this hospital in Temeke district on the outskirts of Dar es Salaam. The labor ward delivers on average 70 newborns a day with only 2 staff per shift. The government of the United Republic of Tanzania is committed to reducing maternal and newborn deaths through various initiatives. Some of the efforts include a developed roadmap to achieve MDG-5, to increase the number of health facilities, to upgrade health facilities to be able to perform cesarean sections and blood transfusions. Also to increase the number of skilled attendants and to improve the referral system, which includes new innovative tricycle ambulances, the provision of essential equipment, and increased availability of family planning services and commodities. Whilst proven cost-effective ways to save the lives of mothers and newborns exist, they are not always available to those who need them most. Public expenditure on health, decentralized financing, resource allocation, and better coverage of essential health package, including maternal, newborn, and child survival services, can work synergistically to effect progress towards achieving the Millennium Development Goals 4 and 5 in low-income countries such as Tanzania.
As we saw from the video, we have made progress in reducing child mortality and improving maternal health. However, we need to do more and we still have some challenges. The government remains committed to ensure Tanzanians attain MDG targets. We have reviewed our national health policy in 2007 that puts emphasis on provision of free services for maternal and children under 5 Already, we have developed a comprehensive primary health services development program in order to ensure access and equity for health services. We will continue to monitor and track the implementation of the roadmap for maternal, newborn, and child health and the health sector strategic plan. We recognize that the achievements are as a result of collaborative efforts of the government, communities, development partners, and the other stakeholders. However, more resources and efforts are needed to accelerate the achievements made so far and scale up evidence-based, cost-effective interventions, and thus we request our partners to continue and intensify support for MDG 4 and 5. We thank you all. Together we can.